I'm Dr. Michael Swan, gastroenterologist at the Victorian Gastroenterology Group and head of endoscopy at Monash Health. If you've been experiencing persistent heartburn, or you've recently heard the term Barrett's esophagus and found yourself Googling at 11 p.m, you're not alone, and I hope this video helps. In this video, we're going to cover what reflux and Barrett's esophagus actually are, what symptoms to look out for, how they're diagnosed, and what treatment and monitoring looks like. My aim is that by the end of this video, you feel clearer about what's going on and what your next steps might be. So what is reflux and what is Barrett's esophagus? Well, reflux or gastroesophageal reflux disease, or GERD, occurs when stomach acid flows back into your esophagus from your stomach. The esophagus is a tube that connects the back of your throat down to your stomach. This often happens when the valve at the bottom of your esophagus doesn't close properly. For most people, reflux is occasional and manageable. But when it happens frequently and over a long period of time, that repeated exposure can cause damage and changes to the lining of the lower esophagus, which we call Barrett's esophagus. Now, I want to say this clearly. Barrett's esophagus is not cancer. The vast majority of people with Barrett's esophagus will never develop cancer. However, there is a very small risk that Barrett's esophagus can develop into cancer, and so we do need to monitor it carefully. And if early changes are ever detected, there are now excellent treatments that can address them before they become a problem. The most common symptom of reflux is heartburn, a burning sensation in the chest, often after eating or when you're lying down. You might also experience acid regurgitation, where you get a feeling of acid or food coming up into the back of your mouth. You may also experience chest discomfort, a persistent cough, or a feeling of difficulty swallowing. Barrett's esophagus, on the other hand, often has no other symptoms despite reflux symptoms. In fact, some people with Barrett's esophagus have very few reflux symptoms, if any at all, which is why long-standing reflux is very important to get assessed properly, regardless of how manageable it is from day to day. Reflux is often diagnosed based purely on symptoms and response to treatment. However, if symptoms are persistent, severe or changing, or if we need to look for Barrett's esophagus, the key investigation is a gastroscopy. A gastroscopy is a procedure where a thin, flexible camera is gently passed into the mouth and down into the esophagus and stomach. It allows us to look directly at the lining of the esophagus to assess for any damage from reflux disease or Barrett's esophagus. And if needed, small biopsies can be taken. The procedure is performed under light sedation, so most patients find it very comfortable and have very little memory of it afterwards. The procedure itself typically takes 15 to 20 minutes. If Barrett's esophagus is confirmed on biopsies, we'll sit down and go through what the findings mean and what the recommended next steps should be. In terms of treatment of reflux, the two main pillars are lifestyle changes and medication. On the lifestyle side, it's important to see whether we can identify and avoid food and drink triggers. Common triggers would include spicy or fatty foods, alcohol, coffee or chocolate. Some patients find that eating smaller meals, elevating the head of the bed when they go to sleep, maintaining a healthy weight range, and not lying down within a couple of hours after eating can all make a meaningful difference to their reflux symptoms. Medications called PPIs or proton pump inhibitors are the most commonly prescribed medications for reflux disease. They are very, very effective, but also discussions need to be had with either your GP or specialist as to the duration and dosage of these medications. For Barrett's esophagus, the management really does depend upon what the biopsies show. For most patients, there are no significant changes to the cells, and the recommended approach is regular surveillance. Periodic gastroscopies every 3 to 5 years is common, where we continue to monitor the Barrett segment and detect any changes early. If early cellular changes are ever detected, there are now highly effective endoscopic treatments that are available that can address and treat them without any need for surgery. We can safely and effectively manage many early abnormalities in a day hospital setting with excellent outcomes. And that's one of the real advances in this area over the last few decades. So in closing, reflux is very common, and Barrett's esophagus, while it may sound concerning, is often very manageable when it's monitored properly. If you've been living with reflux symptoms that aren't well controlled, if things have changed recently with your symptoms, or if you have been diagnosed with Barrett's esophagus and aren't having regular follow-up, I do suggest you ask for a referral from your GP to see a gastroenterologist.